Hi everybody, I'm back with another important high yield video. I'm sorry it's been a while since I dropped the last video. I've been very occupied with work, but now we have only 10 days left and although I received requests for a lot of topics, we are going to try and cover topics which have something new in them, which can be potential questions. Okay, so without further ado, we'll talk about the MTP amendment. So Medical Termination of Pregnancy Act amended. So we are going to talk about what's new, why it was done and what are the significant changes. Right. So we know the Medical Termination of Pregnancy Act has been there for a while and India has been ahead of a lot of other developed countries also when it comes to abortion laws. But the amendment has been a bit to make it even more progressive and make it even more inclusive to all people. The main aim behind it is to create an environment of safe abortions. So and make the healthcare as universal as is possible. So safe abortions, we can consider abortion safe if two requisites are met. One is the person who is conducting it and the manner in which it is conducted. So if these two boxes are checked for us, that is, it is being conducted by an RMP in a proper manner, it is a safe abortion, right? So quickly we'll come into what's different and why. So in the earlier MTP Act, we were doing MTPs only till 20 weeks of gestation. If the period of gestation was less than 12 weeks, we needed one RMP to sign it off. And if it was between 12 and 20 weeks, we needed two registered medical practitioners to sign it off. In the new one, the MTP can be conducted till 24 weeks. Right, till 24 weeks we can conduct the MTP, and if the gestation is less than 20 weeks, we need only one RMP to sign it off, and if it is between 20 and 24 weeks, we need a minimum of two RMPs to sign it off. So this has basically expanded the scope of providing termination of pregnancy in places where less doctors may be available, like your PHCs, right? You may not have two gynecologists available or two RMPs available at a PHC. So if it is less than 20 weeks, remember only one RMP is required to sign the document. Right. Now coming to the other things. The other thing is this you might get in a question. We say that MTP can be conducted up till 24 weeks, but this is only for special scenarios. If you have a couple who is coming to you, say for termination of pregnancy, it is at 21 weeks, but the grounds on which they want to conduct the termination of pregnancy is failure of contraception, then you cannot do it. Failure of contraception, grounds for termination of pregnancy on the basis of failure of contraception is only allowed till 20 weeks, right? The other special scenarios in which we can extend the termination of pregnancy till 24 weeks, I will discuss in a bit. The other change that has happened is that when we talked about failure of contraception, the earlier act talked about the woman and her husband, right? The new act talks about the woman and her partner. So even unmarried women can go to hospitals and seek safe abortion care, safe abortion practices, instead of going to quacks and other places and getting unsafe or septic abortions. So that is the other change that has happened. So woman and her partner instead of woman and her husband, right? So this encourages everybody to seek proper healthcare services. Now, earlier, under a very special circumstance, MTP could be allowed above 20 weeks. That is, if the pregnancy was posing a direct threat to the life of the mother, physical or mental, right? For now, up to 20 weeks, we have contraception failure, like I just discussed. If the grounds are contraception failure, it is only up till 20 weeks, one RMP sign is required. For 20 to 24 weeks, we have 7 special categories, right? In which, for example, you have a minor, or you have a survivor of a sexual assault, or you have somebody whose marital status has changed. At the time that she conceived, she was married, and for example now she is divorced or widowed, or she has been subject to some natural calamity, or there is some grave physical illness or physical disabilities, right? So these are the 7 statuses: minors, survivors of sexual assault, mental illness, minors, survivors of sexual assault, mental illness, grave physical illness of the mother or physical disabilities, change in marital status. For example, she is now divorced. At the time she conceived, she was married and now she is divorced or separated or widowed. And survivors of disasters or emergency situations as declared by the government. And fetal malformation. Right? So these are the 7 points under the ambit of which you can conduct an MTP between 20 and 24 weeks, not failure of contraception, right? Now there is a special circumstance of fetal abnormalities that are so detrimental to the baby that the baby would die at birth, or if it was born, it would have a severe physical or mental handicap. So friends, for that, there is no upper limit of MTP. It is not even 24 weeks. It can be terminated at any time. And for that, it will not do to just have a signature of 2 or 3 RMPs. This has to be okayed by the medical board, which is instituted in medical colleges and will usually consist of a gynecologist, a geneticist, a pediatrician, and a radiologist. Right. So these are the changes that have happened in the MTP Act, and in accordance with the former Act also, the confidentiality of this patient has to be maintained. You cannot reveal her name or details unless the doctor is legally obliged to. Thank you.